We heard about the increasing cases in hospitals over the last few weeks in September. What impact does that have on nurses and the workload that they have in those healthcare settings?
Yeah, so great question. I mean, we know we're going into RSV season, influenza, COVID. Uh, as it stands now, we don't have enough nurses in this province to take care of the demands now. Patients require care, uh, and there's just simply not enough nurses. So this does make for a very challenging situation if this season is serious in terms of the impacts on patients that are getting sick. If it turns out that patients are going to require hospitalization, that is going to put additional strains on the system, and certainly on nurses, but on physicians, other healthcare workers. On any given day, like we are over census, which means that we have more patients than we have funded beds. And the situation is already very concerning, and in fact critical at sometimes, where there's just simply not enough staff. So this is a real concern, and certainly we worry that we're going to see the need for more hospitalizations over this respiratory season, and that's why I believe it's very important that all British Columbians consider this recommendation, for sure. In terms of having the booster vaccine, that's something that everyone should consider doing. But masking, and masking does serve as a way to mitigate the risk of becoming ill. And so, yeah, I think everyone needs to do their part so that we can not overload the system, because it's already under incredible stress.